All right, we are live, so thank you all very much. So with that, we will get the Greater Boroughs Partnership for Health Advisory Board meeting started. It is November 7th, which is crazy. It is 1:31, and we will do a roll call vote. So Westboro,
Jen Sullivan here.
Southboro,
Taylor West here.
Boylston. All right, Anne Maria is waving her hand. And then Northborough, Isabella Crusoe present. All right, perfect. So we have a pretty small agenda today. But first off, just some updates about the Public Health Excellence Grant and staffing. So last time we all chatted was, it feels like yesterday and also 6 months ago at the same time. But we approved to hire Michaela Petty for the shared service coordinator slash regional epidemiologist position. So she did accept the position. She is starting on Monday, the 18th. So very excited to get her onboarded and started. That process will include training from me for both positions, as well as meeting the health director and department for all of the towns. So be on the lookout for an email from me to kind of set up a meeting for Michaela to get acquainted with our region and each health department, because we all work slightly different. Any questions about that position? Any recommendations for training?
What do you mean?
Anne Marie. Anne Marie, did you join another device? All right. Well, with that, the regional public health nurse, that position is still open. So we are looking for applicants still. So if you know anyone, or if you could post it on any other job board. So currently it's on MHOA, it's on MAPHN. It is posted on the Pulse newsletter through the local Office of Regional Public Health. Taylor, do you have any other ideas? Nursing wise?
I posted it on the nursing Discord page and I also posted it on just the town website.
Okay, all right.
And the MAPHN and MHOA ones are both new, so they're not the old job description is updated with a new date. So hopefully that will help and it brings it to the top
All
of the
right.
list again.
Jen or Anne Marie, any other ideas for recruiting that full-time public health nurse?
No, looks like you covered all the bases.
All right, perfect. Well, we will keep everyone updated. As we did before, we did interview some people and it just didn't work out. They did not accept the position as we did before. Taylor will be on that interview committee with her background in nursing. And with Diane. What?
Depending on when it is.
Oh, very true. Yeah,
When
and
is your due
you're
date?
leaving December, right?
I'll be out December 13th is my last day.
Which is why it is very important we hire a full-time nurse. Hi, Lisa, how are you? All right. So talking a little bit about, honestly, Taylor, thanks for bringing that up. So Maven coverage for the four towns. So currently Penny, our regional nurse, is on Maven for all four towns, which is great. She works Monday, Tuesday, Thursday, so that provides backup on those days. When I was the epidemiologist, I had access to all four towns. So I'm just asking, as I start to onboard Michaela, who wants Michaela to be on their town's Maven to add extra coverage and backup?
Yes, please.
So,
Yeah.
yes, Jen? And yes, okay, so great. So I will add her to all four towns once she's onboarded. She was already an epidemiologist in another town, so she already has Maven access and Maven training, I should say. So we will get that onboarded pretty fast, and obviously she'll be 40 hours, so she can be backup coverage, whatever that may look like.
Great.
Okay. Jen and Anne Marie, just to update. So Northborough and Southborough have gone ahead and we interviewed for a town staff position, the health agent, Northborough and Southborough. So once we get that position onboarded, Jen, I know we talked about some food backup. from Michael. So once we get that position onboarded, we will be able to kind of shift roles and responsibilities, and Michael will be available for, I think you said 8 to 15, 10 hours. We can work out that kind of
Perfect, thank you.
logistics. But that's an update on that. Any questions about staffing or hiring?
We were going to discuss a possible person to cover hoarding.
Yes. So last time we talked, was it the hoarding contract? Right.
I think we were gonna see who takes the benefits if we had any more money left over.
So currently Michaela hasn't, I don't know the status of her health insurance, so I can't run that budget number, and it's a little tricky without the nurse. But because it's already November and the fiscal year started, we're definitely gonna have some funds left over. So if people are interested, I can absolutely look into that hoarding contract. It would be the organization that did that training back in May.
Do you remember the name of that?
Um,
I don't off the top of my head.
Is it clear?
Clear path.
Clear Path. Thank you. Good memory, Taylor.
No, I just looked at an email.
Oh, Taylor pulled it out though.
Oh, good.
Yeah.
Yeah, but so Southborough actually recently or started a hoarding task force.
Not hoarding specific, but housing task force. And I think we're just looking into them having come do a training similar to the one that we already did just for building and youth and family services. So
Okay. So I know Westboro would be interested in it. Boylston and Southborough, would you be interested if the money was available to do a hoarding contract?
sure.
That would basically be that group who would be able to do the hoarding cases or facilitate the hoarding cases that we experience in our towns.
Yeah, no, I think that's great.
Okay, so by our next meeting, I'll try to send out an email once I have the updated insurance information to see what that contract, like how many cases we could do per month. And maybe invite Lynn, who I think is their director, to come talk to our group. That might be helpful. Anything else regarding staffing, changes, updates, grant? All right. So moving right along the substance use prevention work, we have opioid funds, and I know we talked about kind of keeping this on the agenda for the foreseeable future to talk through some ideas. I know we're all at different stages, but any towns have any updates, projects in mind?
Can we have an update of where everyone is?
Yeah. I'll go first. So Northborough, so we did kind of our data collection regionally, which was a huge help. So basically we would be able to, fund a project. It would need to go through the Board of Health and then the Select Board. So we would just need like ample amount of time to get approval. We're also working with our Be Well group to kind of think about any projects that would be helpful, to make sure they're data driven and community specific. But that's where we are.
Are we wanting to regionalize this or are we keeping this separate?
I think
That's what I guess my question is.
We haven't gone that far in our planning process yet. We're trying to get a key group of people in town together to see what they would be agreeable to. However, it does go through the health department or Board of Health for final say. I know we had expressed interest in just putting aside some of our money to continue with a position funded through a grant right now, but that's the only thing that we've really talked about, and then some school programs.
I'll go Westboro. We do have the key holders involved. The big question is if we're going to be doing it regionally. That's where we're at right now because we don't want to be going forward with something that, we all agree upon and then repeat. So I think we're kind of in limbo right now. I know some town managers were interested in also regionalizing. I believe Northborough is one of them. So I guess it does also go through the Board of Health. So if we decide here, I don't know what steps you need to do to have that agreement in place because we are a part of this. So I don't think any agreement is needed further than this. However, I don't know about letting your, town managers know and your select board know.
I have a question. Hi, Isabella. I'm sorry I didn't say hi earlier.
No worries.
Couldn't hit mute fast enough, so I just waved. Good to see you back.
Yes, thank you.
And congrats.
Thank you.
I might have, I don't know if this is even in the purview of what you're talking about. Is there anything about food insecurity that might be worth considering? It certainly pops up here and there more often than we might realize. And I just was wondering if that might be something. You're all boots on the ground. I'm not so much, but just a little bit of what I'm hearing in the community. And it's only Northborough that I'm speaking of. Just a thought.
We have that study that was done that was really helpful. Have you looked at that?
I have not personally.
Oh, so if you read that, it's really helpful on your location or what town, that you are in. Who put that together? What was her name?
For the opioids?
No, the food insecurity.
Oh, the intern.
Yeah,
Gabriella Knox.
that's it. She did a
So
great
Lisa,
job.
I can send it to you. So we do have, and any town can get them or I can drop them off, but the resource guides, it's basically food specific. It has all 4 towns. Also instructions of how to apply to SNAP, WIC, and any other, food pantries in the area. That's also available on our website, but I definitely think like doing outreach and making sure people are aware that it's an option. For example, in Northborough, we just hired a community outreach coordinator. So, going to the Northborough food pantry or going to outreach events to make sure that, individuals and residents know that's an option.
Right. That was making that connection. I think there is a gap there. So that's great.
Yeah.
Okay.
But
All
as
right.
far as using opioid settlement fund money, it probably would not apply.
And that's where that funding's coming from. Forgive me. Okay.
No, it's
Yeah.
definitely helpful. But we can definitely improve, outreach and education because I think like the SNAP gap is pretty high. Basically the people who are eligible for SNAP, but the people who are actually
Utilizing it.
exactly.
So on that, talking about opioid addiction
Mhm.
funding, gambling addiction, there's certainly an issue with that. I don't know if it's as prevalent
No, does
in our
not.
Unfortunately, no.
Okay. All right.
Yeah, there's some state resources. I'm not sure the funding. The funding is pretty specific, but also can do mental health education prevention type thing. Which is definitely, I think, a focus of our towns. Anne Marie, has Boylston done any talking about opioid funds or money? No, okay.
Do you know if they'd be interested in regionalizing?
Yes, Boylston
Fun.
would be interested in regionalizing.
And Jen, when you say regionalizing, would you talk like putting all of the money in one bucket or kind of doing like some regional projects?
I would say, either one is fine. I just think as a group effort, it would be better and less time consuming for all of us.
So I think next steps, if we could all talk to our boards of health or town administration, see if that is something that they're interested in and come back with, a final answer and we can, I can also identify if we needed another IMA. I'm not positive one way or the other. But I think we should all come back and kind of come to that consensus so we can do some planning and work around that.
Yep, I agree.
Any other comments on that? The only thing I can think of that why I was asking all or just some, we also want to use some funds for our Northborough Southborough Substance Use Prevention Coordinator, and currently that grant only goes till year 5. We would be hoping to, well, will be applying for years 5 through 10, but it's definitely more competitive. So just wanted to leave that wiggle room.
Yeah, and also it makes sense since we all get different amount of funding, so.
Right. All right. Great. Well, that was really all that I had on the agenda. Any other business or updates that people want to share? Is anyone going to MHOA? No. Oh, you are, Anne Marie? Great. Jen will miss you.
Thanks. Couldn't get away.
All right. Anything else? I don't want to keep the meeting short if there's other updates to be discussed. All right, so next steps, look out for an email from me to set up a time with Michaela, to make sure that she's onboarded and gets to know everyone. I will do most of that training, focusing on the shared service coordinator because she does have that experience as a regional epi. I will have her added to everyone's Maven, which will be greatly helpful to, just increase capacity and coverage. And then try to have those conversations with your boards of health and town administration regarding the opioid funds. So at our next meeting on January 9th, we can talk a little bit more about that and really come to a decision. So we have time to really think about and plan those funds.
And hopefully you'll be fully staffed. We'll be fully staffed too.
Yes, please share out that regional public health nurse job position. We will keep pushing and see what we can get.
All right. It's good to see
Alrighty.
everybody.
Yeah, so our next meeting will be January 9th. We are doing meetings every 2 months. Every 2 months, yes. We were doing them quarterly. Now it's every 2 months, Thursdays at 1:30. But with that, if someone wants to call the meeting.
I make a motion to adjourn.
Second.
Okay, all those in favor, Westboro,
Yes.
Southboro?
Yep.
Anne Marie,
Yes.
Boylston, and Northborough. Isabella, aye. All right, so I will see you all January 9th. We'll have at least one new staff